Assalamu alaikum dear students. Today we will discuss top 50 nursing MCQs part 3rd. The largest gland in the human body is option A pancreas, B liver, C thyroid, D adrenal. Correct option is B liver. Which disease is prevented by the BCG vaccine? Option A measles, B polio, C tuberculosis, D tetanus. Correct option is C tuberculosis. Herd immunity refers to option A protection due to the personal immunity, B protection due to mass vaccination, C protection from isolation, D immunity due to diet. Correct option is B protection due to mass vaccination. A sign of respiratory distress in newborns is option A bradycardia, B nasal flaring, C hypotonia, D jaundice. Correct option is B nasal flaring. Subscribe now and press the bell icon. Never miss an update from a technologist. Which hormone is responsible for uterine contraction during labor? Option A oxytocin, B estrogen, C progesterone, D prolactin. Correct option is A oxytocin. A woman is considered in menopause if she has not had a menstrual cycle for option A 3 months, B 6 months, C 12 months, option D 24 months. Correct option is C 12 months. A patient with major depressive disorder may experience option A hyperactivity, B loss of interest in activities, option C increased social interactions, option D euphoria. Correct option is B loss of interest in activities. Which neurotransmitter is most affected in schizophrenia? Option A dopamine, B serotonin, C acetylcholine, D GABA. Correct option is A dopamine. The best therapeutic approach for managing anxiety is option A deep breathing exercises, B avoiding stressful situations, C taking sedative only, option D isolation. Correct option is A deep breathing exercises. A patient with obsessive compulsive disorder may option A experience panic attack, B have repetitive behavior, C avoid social interactions, D show excessive anger. Correct option is B have repetitive behaviors. What is a common side effect of antidepressants? Option A increased heart rate, B weight gain, C excessive anger, option D hyperglycemia. Correct option is B. Weight gain. Which disorder is characterized by extreme mood swings? Option A. Generalized anxiety disorder. B. Major depressive disorder. C. Bipolar disorder. D. Schizophrenia. Correct option is C. Bipolar disorder. The most common symptom of schizophrenia is depression. B. Hallucination. C. Aggregation. Aggression. Option D. Hypersomnia. Correct option is B. Hallucinations. The best way to prevent malaria is option A. Vaccination. B. Mosquito control. C. Taking antibiotics. D. Avoiding raw food. Correct option is B. Mosquito control. The best therapeutic approach for an anxious patient is option A. Encouraging relaxation techniques. B. Providing strong sedatives. C. Keeping the patient isolated. Option D. Using physical restraints. Correct option is A. Encouraging relaxation techniques. The primary treatment for bipolar disorder is option A. Diazepam. B. Lithium. Correct option is B. Lithium. The primary cause of sudden infant death syndrome is bacterial infection. B. Unknown. C. Viral infection. D. Hypoglycemia. Correct option is B. Unknown. Which of the following is a sign of Down syndrome in a newborn? Option A. Hypertonia. B. Single palmar cries. C. High pitched cry. D. Enlarged tongue. Correct option is B. Single palmar cries. The most common site for ectopic pregnancy is option A is cervix. B. Fallopian tube. C. Ovary. D. Uterus. Correct option is B. Fallopian tube. The most effective method for birth control is option A. Condom. B. Oral contraceptive pills. C. Intrauterine device. Option D. Abstinence. Correct option is D. Abstinence. The common cause of postpartum hemorrhage is option A. Hypertension. B. Uterine autonomy. C. Hyperemesis gravidarum. Option D. Preterm labor. Correct option is B. Uterine autonomy. The best way to prevent neonatal infection is option A. Immediate breastfeeding. B. Skin to skin contact. C. Proper hand washing. D. Delayed cord clamping. So correct option is C. Proper hand washing. A patient with obsessive compulsive disorder has option A. Repetitive thoughts and actions. B. Visual hallucinations. C. Flight of ideas. Option D. Severe mood swings. Correct option is A. Repetitive thoughts and actions. Thank you for watching my videos.